Okay, let's look at some medical effect of sulfur here and its application in the military and some management due to injury. So here we have phosphorus again. Phosphorus, atomic number 15 and atomic mass of 30.97, approximately equal to 31, and it's in the group here now, the 15th, and in the K shelf in the third period. Oh my God. So here we have it in the card, phosphorus 15, 30.97, approximately equal to 31 from our card. And they're concentrating on white phosphorus here. Said here, waxy solid, yellowish in color. Is sometimes colorless in solution, which ignites instantly in contact with oxygen, and is used in the militaries to illuminate battlefields and a smoke screen, and it smells like garlic. No, this white phosphorus can cause deep damage, deep burns, penetrating even to the bones. And smoke from the burning phosphorus can also cause harmful eye effects. It can cause harm to the eye and to the respiratory tract. The smoke consists of phosphoric acid, and if there's moisture in the air, the phosphorus oxides will be turned into phosphoric acid. So that would be the constituent of the smoke. So white phosphorus now is used in the military it's used in grenades as well. It's used to illuminate the battlefield and in incinerators. It's used in grenades and artillery shells. In severe cause of exposure, it can cause delayed systemic effects, and cause cardiovascular damage and collapse. Can cause renal and hepatic renal damage as well as hepatic damage, and which can lead to coma, death. Can lead to coma, and death may occur from shock. Due to hepatic or renal failure, central nervous system or myocardial damage. So we're moving into the effect of the impact of sodium, whether by burn or by other impact upon the human, the smoke inhalation and so on. Okay, dermal effect. Exposure to white phosphorus can cause deep burns, and the burns are extremely painful. And this results from chemical as well as thermal injuries. The affected areas of skin, the affected area of the skin burn may appear sort of yellowish and resulting from a necrotic and full thickness burn. So yeah, the skin or dermal burn may appear yellowish, which will reveal necrotic tissues and full thickness burn. And this will be surrounded by sloughed tissues. As far as this white phosphorus is soluble in lipids, and you know the biochemistry of the skin, what is there, and the water and the solutions in the skin there, the phosphorus particles can react and cause continuous burn via these phosphorus particles. So they have to be removed by forceps. It's best to remove these particles of phosphorus which are reacting with the moisture in the skin, the lipids and everything, and causing continuous burn, to remove these particles by forceps and not by the hand or even by gloves. The forceps is a better method of removing. As you know, it will penetrate the underlying tissues and resulting in deep burns, and which are slow to heal. Caution should be exercised for spontaneous ignition of white phosphorus particles remaining in the damaged tissues, and smoke emanating from the wound. Yeah, the eyes, white phosphorus particles may cause corneal burn, and this is the impact with the eye now. The white phosphorus particles may cause corneal burn and perforations, and the smoke may cause ocular ocular and irritation and blade far spasm. Photophobia, nausea with the eyes, and conjunctivitis with lacrimation. Inhalation, the smoke or burning phosphorus may cause irritation of the upper respiratory tract and delayed onset edema. Let's see what they're saying here every time. In the management of this white phosphorus and the impact and the with burns and all of that, sometimes it's necessary to call in the WHO, the World Health Organization, the ACS, American Chemical Society, the CCCW, which is the Convention of Certain Chemical Weapons, and the CWC, which is the Chemical Weapons Convention. So that's how deep this thing goes. And the usage of it in wars, you could further research that, but I've just given you just a brief sort of a description of what happens here when it is used in the militaries. It is not considered really as a weapon of mass destruction as such, but it really can cause destructive impact upon military personnel, as well as anybody that comes in contact, whether by accident, with this phosphorus burns. But it needs to be controlled, and it's controlled via the WHO, the ACS, the CWC, and the CCWC with regards to the military. So that's just a look at phosphorus. Oh, it's very dangerous to the human and harmful, causing very painful burns, and the management is very difficult as well, because you know after you continue to use water with saline solution, and the water has to be cold and not hot, how you know the phosphorus can react with water to give you phosphoric acid. So it's a very integrate sort of management there with the phosphorus, and these particles, while in the skin and causing more burns and perpetuated burn, and you put water there, and the phosphorus react with the water to give phosphoric acid and continuous burn. But in that case, cold water and the right amount, you dilute the phosphoric acid. But it's really an intricate situation that require specialists in the burn unit. So that's a look at phosphorus. We have looked at the negative impact of phosphorus, but it does have some positive usage, making soaps and other such things. I think it's used in certain matches as well. And it's useful in the human being, in the bones and the teeth. I think a deficiency would be hypophosphatemia, and an above normal amount of it in the body would be hypophosphatemia. So there's hypo and there's hypophosphatemia, and like I said, it's as its rightful amount in the bones for the growth of the bones and the teeth. So you find more of that in endocrinology. We have hypocalcemia and hypophosphatemia, hypomagnesemia for magnesium, calcium, phosphorus, and other chemical that have its discrete and precision amount in the body for the health of the body. This is again on the periodic table, the 15th group, and the third period, atomic number 15, and atomic mass of 30.97, approximately equal to 31, and electronics configuration of neon 3s2 3p3. That's phosphorus.